Hi, I'm Dr. Kathy Kerr at the Edgemont Veterinary Clinic, and I'm here today with my assistant Chelsea to show you how to give subcutaneous fluids to your cat or small dog. The reason we would do this is to rehydrate them if they've been ill. Particularly, it's something we do really commonly with kidney patients, just to help supplement their water intake. So I am going to go through how to set up the bag first, and then we'll show you how to actually administer it to a patient. So this would be a bag of fluids. This one happens to be saline. Usually we would use something with a electrolyte balance that's a little bit more complete for a kidney patient, but we're going to start with using this bag. When you first get the bag out of the packaging, the first thing you need to do with that is to remove the end off the one side here so that there's a hole that you can put the port into. So Chelsea's going to hold that for me just now to keep that end clean. We will send you, when we're setting up this procedure, to go home with you with one of these intravenous lines as well, and there's also some prep that needs to happen with these. The first thing you need to do is close off with this little rolling device here so that fluid does not run down the line and out the other end and make a giant mess for you. The next thing you're going to do is unsheath the pointy part that goes into the bag. And you're going to push that in just as far as it can go, twisting it a little bit so it gets a good seal there. And then ideally you have a hook or something that will help hold that so that you've got some gravity feed there. Chelsea's going to hold that for me for now. You give this a little bit of a squeeze so that you get this half filled in the center part here, and you'll actually be able to see drops coming down about where my thumb is once you actually turn this on. The next step is to open up the end of flow here. So you're going to reopen this, but you're going to be prepared for the fluid to come down and out the other end. And you can actually see as I open that fluid starting to come down up at the top, and eventually all the bubbles are going to come through and liquid will start to come out the end here. And that'll probably show up on the towel there as that starts to drip. The reason we want to run all that water through first is to make sure that we don't inject air. I know there's a lot of information and concern about putting air into a body. The biggest concern is if that's put into a blood vessel. Putting it under the skin is not typically a huge concern, but we absolutely don't want to do more of it than necessary. So we want to make sure that that line is run through completely before we actually administer fluids. We're going to put this needle on the very end, and then you can secure that with this little locking device that twists up on the bottom there. And then this bag is ready to administer fluids. If you'll pay attention to this little marking on the side here, you can actually see where volumes are measured on the bag, and that's how we control and monitor how much fluid we're actually administering. Typically, a cat would be given somewhere around 100 milliliters at a time for your average cat, but that's something that your veterinarian will give you specific instructions if you are doing this. So once you're familiar and comfortable with getting the line set up together, we are going to now show you how to actually administer it to your pet. So we're here with Hobbs now, and he's going to be our demo kitty so we can show you how to actually do the injection part of giving fluids. So Chelsea's going to help us with a little bit of gravity. Ideally, we want to hold the bag up as high as reasonably we can to make the process go a little bit faster. The lower you hold the bag, the slower the fluids will go. The higher you hold the bag, the faster the fluids will flow. So when you're giving the injection, we want to aim in this area, sort of between shoulder to shoulder, across the top of their back. And the reason we want to do that is they're kind of used to being scruffed when they're kittens, and there's lots of extra tissue here for them to have space to give us that little bolus of fluids. It's also a place where they're most tolerant of actually having that injection done. So we're just going to open up some food for Hobbs and see if he's going to nibble his way through this. The more you can distract them, the better. So if they're willing to eat through this and make it a happy experience, then that's the best thing to do. I'm just creating a little bit of a tent with my fingers, so 4 fingers in the front, 1 thumb at the back. And you want to aim the needle so that it's just a little bit below your thumb. You do need to be careful you don't go straight through to the other side. You want to aim down just a little bit. And Hobbs didn't even notice when I put that in. Once the needle is in, you're going to open up this little port and let the fluid start to flow. And you can see that starting to drip there. Good boy, Hobbs. If you put that food closer, he'll just eat. So Hobbs doesn't really seem too concerned about this. One of the biggest things I think that makes it difficult for pets and people is the more stressed the people are, the more stress the cat is going to get. So if you set them up with some food and it's a low stress kind of thing for them to do, their tolerance is actually very good for this. Good job, Hobbs. When you're taking the needle out, you just pinch the skin so that you don't get a lot of fluid leaking back out after you've so carefully put that in. So you're just going to pinch right around the needle and then just pull that directly out. When you have finished giving them the fluids, you will typically see a little bit of a bolus of fluid sitting here. I like to call it their Hunchback of Notre Dame look. They will absorb that fluid over the next couple of hours, depending on how dehydrated they are to begin with. Sometimes that fluid will fall down to either shoulder a little bit, and that's absolutely normal. As it's absorbed, it will go right back to the normal way they look. I'm Dr. Kathy Kerr at the Edgemont Veterinary Clinic. Thanks very much for watching this video. If you have questions about how to administer fluids to your pet at home, please do contact us and we'd be happy to help.